Welcome to Our Daily Health. Diastasis Recti, 10 exercises for diastasis recti. When pregnant women's bodies will go through many incredible changes to make room in the abdomen for the growing baby. One of these changes is the abdominal muscles expanding as the pregnancy progresses. The left and right sides of your abdominis rectus muscles separate, and the linea alba, which is a tissue between the set of muscles, stretches to create space for the baby. After the pregnancy, many women will notice that they have an indentation or a gap in the middle of their tummy where the six-pack should be. The separation of the abdominal muscles is expected after pregnancy, but if the gap is very wide, you have diastasis recti. Diastasis recti is a common condition, and about 1 in 2 women will experience it after pregnancy. Symptoms of diastasis recti are back pain, pelvic floor issues, poor posture, gastrointestinal problems, and abdominal weakness. This separation of ab muscles will normally repair itself, but you can encourage the healing using targeted exercises that will help close the gap faster. To treat diastasis recti, you need to strengthen your core muscles from the inside out. The transverse abdominis, TVA muscle, is the deepest abdominal muscle, and it helps to support the muscles that have been stretched. These are the muscles that you require to strengthen to heal from diastasis recti. It is also important to strengthen your pelvic muscles and diaphragm, which work together with the ab muscles. Many simple exercises will rebuild your transverse abdominis muscle. Engaging your pelvic floor and breathing deeply while performing these exercises is important. Note your progress over time, and when your gap feels more resistant, you can increase the intensity of the ab exercises. Stay away from crunches and planks until you have built strength in your abs and the gap is reduced. Such exercises will make your diastasis recti worse. Always be mindful of how your body feels when doing the exercises, particularly in the core. Remember that when getting back to exercising postpartum, you need to build up your strength gradually. It is advised to talk to your doctor about the best progression for you to ensure you do not hurt yourself working out. Diastasis recti, 10 exercises for diastasis recti. 1. Diaphragmatic breathing. The first part of any diastasis recti exercise is to breathe properly. Many of us typically breathe from our chest, which is harmful to the neck, shoulders, and back, and may result in pain in these areas. Chest breathing creates muscle imbalance in the body as a core function is being neglected by the breath. Lie on your back and place a hand on your chest and the other on your abdomen. Inhale slowly and deeply through your nose and try to send the air to your belly and lower rib cage. Let your stomach rise as you fill your lungs with air. Exhale with a sigh and tighten your abs. On the exhale, feel your tummy fall. Repeat this breath in various positions, on all fours, lying on your side, seated, kneeling, and on your feet. Keep practicing until this pattern of breathing becomes your norm. Number 2, single leg marches. Single leg marches help with a proper core activation when moving your hands and legs. When doing them, you need to keep your abs tight and hugged in when lifting your leg so that they don't push up and away from your body. Start by getting on your back with feet flat on the floor and knees bent. Exhale deeply and activate your pelvis as you march your right foot an inch off the floor. Return your foot to the ground and repeat this on the left side. Number 3, heel slides. Heel slides help to release the tension in the back and hip flexors while engaging the pelvic floor and core. This is great for returning to your natural alignment and coordinating your inner core muscles. Focus on initiating the exercise from your core instead of your spine, pelvis, or hip flexors. Get on your back with feet on the ground and knees bent. Exhale deeply and activate your pelvis as you slide your right heel to fully extend the leg. Inhale again and exhale as you slide your right leg back to the starting position. Repeat this heel slide on the left side. If you are enjoying this video, then please like, comment, share, and subscribe to Our Daily Health. Number 4, single leg lift. Start by getting down on your back with your knees bent and feet flat. Lift your right leg slowly until the knee is right on top of the hip. Lower the right leg back to the starting position and repeat on the left side. Number 5. Leg lifts. Leg lifts help to encourage the right use of your core so that your body can remember how to use the correct core mechanics. Start by lying on your back with your legs fully extended. Exhale deeply and activate your pelvis as you lift your legs 1 inch off the ground and put them back down. Number 6. Bird dog. Start on all fours, then exhale and draw up the core towards the spine. Keep the core contracted as you inhale, reaching your right arm out and your left leg behind you. Exhale as you tap your right elbow on your left knee, then inhale as you reach limbs long and return to the starting position. Repeat this on the other side and keep alternating sides. Number 7. Toe taps. Start by lying on your back and bringing your legs to a tabletop position with the knees directly above the hips. Avoid tucking your pelvis or arching your back. Inhale deeply and exhale as you tap the right foot on the ground while hugging in your core to your midline and ensuring pelvic alignment. Inhale deeply and return to starting position. Repeat the toe tap on the left side and keep alternating sides. Number 8. Double leg stretches. Start on your back with your legs in the tabletop position with your arms framing your knees. Exhale deeply as you extend your leg diagonally with your arms extended overhead. Ensure that the back is flat and the pelvis still. Return to the starting position on the inhale. Number 9. Side plank. Side plank is an excellent alternative to high plank as it can be done throughout your postpartum journey. Put your right elbow directly below your right shoulder and place your left leg in front of your right leg, having both feet touching the floor. Ensure that your hips and shoulders are placed in line with your head and feet. Hold this pose for 15 to 20 seconds as you hold your core tight. Number 10. Knee drops. Start by lying down on your back with your knees bent and feet flat on the floor. Lower one or both knees to the side. Use your abdominals to raise the knee or knees to the starting position. Bottom line, diastasis recti is an issue that affects many women postpartum as a result of drastic changes that occur in pregnancy. It can be repaired by performing several simple exercises that don't require any equipment, and you can do them in the comfort of your home. You may not be able to perform all of these exercises listed above just after your pregnancy. Take it easy and start slowly, working your way up as you get stronger. Which of these exercises for diastasis recti do you like best? Comment your answer below. If you like the video, give it a thumbs up and share it with your friends. For more health and wellness topics, please subscribe to Our Daily Health.